We are in the midst of a series entitled Secrets from a Breast Surgeon. Here I will share details and evidence which I know, as a surgeon, that can have an impact on a patient's outcome. The information is vast and will be covered over several videos. In this video, I will be discussing reoperation rates for breast conservation treatment and compare them with mastectomy with implant reconstruction. At the end of the video, I will share what experts considered to be the best surgical treatment option for early-stage breast cancer and how reoperation rates for this option can be significantly reduced. So, if you know someone who may be making a decision about breast cancer surgery, you might wish to stay until the end. Before we begin making some comparisons, allow me to put breast cancer surgery into context. The surgical treatment of breast cancer can be classified into two broad groups of operations. The first is breast conservation treatment, where the cancer is completely removed with a rim of uninvolved tissue all around and is usually followed by radiotherapy. The surgical procedure may be referred to in several ways. Medically, the operation can be termed as breast-conserving surgery, lumpectomy, wide excision, segmental mastectomy, or partial mastectomy. The other group of operations is classified as mastectomy, which is the surgical removal of the breast. Mastectomy may be performed in the standard fashion, a skin-reducing, skin-sparing, or nipple-sparing manner, and may be done in conjunction with reconstruction. As mentioned earlier, in this video, I will share the available data on reoperation between breast conservation surgery and mastectomy with implant reconstruction. We begin with mastectomy and implant reconstruction. A comment by a fellow breast surgeon inspired me to do research on mastectomy with implant reconstruction. So I researched data published in 2026 on this procedure. One of the areas was on surgical complications. What I learned greatly startled me. Find out with me why it was and still is so surprising to the point of being shocking as I journey through the data and evidence. In 2016, this study led by Dr. Pfeiffer from New Hampshire reported that women with mastectomy and implant reconstruction encountered a complication rate of 5.5%. So it was shocking to me that in this study conducted by doctors in Australia and published in 2026, that the research team reported that women who underwent mastectomy with implant reconstruction had an overall complication rate of 58.9%. In addition, among 55 women who had 95 breast cancer surgical procedures performed, 50 underwent long-term revision surgeries. This means that 52.6%, or more than half of the women, required at least one other surgery. The authors of the article state that revision surgery is not unexpected in implant-based reconstruction, and they cited a Canadian study which reported an unplanned breast revision rate of 88% at a median follow-up of 5 years when both autologous and implant-based reconstruction were included. They also referred to another study conducted in Australia that reported a revision rate of 25.3%. Therefore, women who elect to undergo mastectomy with implant reconstruction should be informed that a revision surgery has been reported in 25.3 to 88% of patients. Now that we know the data for the likelihood of reoperation after mastectomy with implant reconstruction, we can compare this rate with that for repeat surgical procedures after breast conservation treatment based on current research data. In this 2025 article by Dr. Daniel Leff from Imperial College in the United Kingdom, he cited several publications and reported that reoperation rates in breast-conserving surgery are between 19 and 30%. A year earlier, in 2024, this article was published, reporting that overall re-excision rate for breast-conserving surgery at this center in Alberta, Canada, was 11.4%, with a completion mastectomy rate of 5.2%. Therefore, for women who undergo breast conservation treatment, research data shows reoperation rates of between 11.4% and 30%. In an audit of patients undertaken by my colleagues and I, of 161 patients, 4 underwent reoperation, with a reoperation rate of 2.5%. This was achieved using a pathology technique known as frozen section. I will be discussing more details in another video about the techniques used to reduce reoperation rates. To summarize, research data in the years 2024 to 2026 show reoperation rates for breast conservation treatment to be between 11.4% and 30%, while those for mastectomy with implant reconstruction have been found to be between 25.3% to 88%. Finally, it is important for all patients diagnosed with early-stage breast cancer to be aware of this consensus statement made by an expert panel who convened at the 2025 edition of the St. Gallen International Breast Cancer Conference. The panelists believe that patients should be advised that breast-conserving surgery and radiation therapy is usually the best treatment option for eligible patients. The association of breast conservation treatment with less morbidity and fewer complications were among the reasons cited for this recommendation. The generally lower reoperation rates for breast conservation reported in the studies discussed in this video would be consistent with this comment. Thank you for staying until the end of the video. If you have found the information useful, please like, share, and subscribe. Please enter any questions you may have in the comments section, and I will do my best to address them. You may also submit a request at the Just Medicine website. There are more videos on little-known secrets of breast cancer surgery, and I hope you will join me there too. Until we come together again, take care.